talking about bad cholesterol, and I'm giving you 10 quick ways to improve your cholesterol numbers. Tip 6. Quit smoking. Just please quit smoking cigarettes. If you look at practically all disease processes and then you scroll down and you find out the risk factors, you will find that smoking cigarettes is on just about everyone's list. Smoking cigarettes is a risk for heart disease. Smoking cigarettes is a risk for lung disease. Smoking cigarettes is a risk for lung cancer. Smoking cigarettes is a risk for cervical cancer. And yes, smoking cigarettes is a risk for having high levels of bad cholesterol. So you want to quit. Cigarettes actually increase the inflammation within your blood vessels. And when you have high cholesterol, it loves sticking to inflamed blood vessels. So yes, having the cigarette smoke and having the inflamed blood vessels will put you at the higher risk for having these atheromas or these atherosclerotic plaques, which can lead to clogged arteries and cardiovascular disease. Quite honestly, nicotine addiction is very, very strong. There is a center in the brain that make it physiologically very difficult to quit smoking when you have that physical addiction as well as a psychological condition. So I recognize that it's not easy, but there are different counseling processes. There's even certain medications that can help, nicotine patches. Make sure you consult with your physician because you definitely want to stop smoking cigarettes in order to improve your cholesterol numbers. Tip 7, limit alcohol consumption. Limit your alcohol consumption. And yes, when it comes to high cholesterol, sometimes you can blame it on the alcohol. It's for real. Now, I know that alcohol is associated with just about every social event, every festive event, but when drinking alcohol in excess, especially if you're binge drinking or drinking daily, or if you're exceeding the recommended amounts for what's considered a safe amount of alcohol consumption, this can increase your risk for high cholesterol and ultimately cardiovascular disease. In order to learn the recommended amounts of alcohol and ways that you can safely limit your alcohol consumption, be sure to watch my video on the dark side of alcohol after you finish watching this video. Tip 8, use plant sterols and stanols. Now, plant sterols and stanols have an especially interesting role. These are compounds that are naturally occurring in plant-based foods, and they actually look and act like cholesterol. But if you eat these plant-based foods that are high in plant sterols and stanols, they can actually help you to lower your bad cholesterol. Some foods that are high in plant sterols and stanols that you should definitely incorporate in your diet to help to improve your cholesterol numbers include broccoli, red onions, carrots, corn, spinach. Tip 9, consider omega-3 fatty acids. Yes, omega-3 fatty acids have been associated with lowering bad cholesterol. They help to absorb the bad cholesterol, they help to decrease inflammation in your blood vessels, and they help you to get better cholesterol numbers. Again, foods that are high in omega-3 fatty acids include fatty fish like salmon, mackerel, sardines. Also, nuts can be loaded with omega-3 fatty acids. Tip 10, manage your stress and get proper sleep. Now, of all of the tips I've given you on improving your cholesterol numbers, many of you will find this one the most challenging because there's stress coming from everywhere, from the left, from the right, from school, from the news, from world events. We always have some type of stress, right? So how do you manage it? Well, one thing you can do is learn to control what you can control. And for the things that are completely out of your control, don't spend your time worrying about them and stressing out, because when you stress out about things that you can't change anyway, that increases your stress hormones like cortisol, adrenaline. It causes a tightening of the blood vessels. It can lead to increased inflammation in your body, and ultimately, it's not good for your cholesterol. Also, you want to get proper sleep. Most people require anywhere from 7 to 9 hours of sleep a night. You want to make sure you consult with your physician to find out what sleep is appropriate for you. But when you get sleep that is restorative, not just restorative for your body, but also restorative for your mind, and it's good for your overall health. Now, here are some tips for reducing your stress, in addition to not worrying about those things that you can't do anything about. You want to meditate. And meditation does not mean just sitting in a corner and being quiet while you think about your things to do list or you think about a funny joke that you heard. No, meditation means clearing your mind and really getting yourself in a place where you have peace and where you are okay with just being still. Okay. Also, doing things like yoga can help. Practicing slow, deep breathing, okay? Breath practices can help with reducing stress. Making sure you do time management, where you plan to get to events early so you're not stressed out trying to find a parking space, or running trying to figure out where you're supposed to be, or breathing and sweating once you rush into the event where your mind's not really right, okay? Practice good time management. Keep things to-do lists and try to organize your life. That's something that can help to reduce your stress as well. At any rate, managing your stress and getting proper amounts of sleep, hey, that's another tip for maintaining good cholesterol numbers. So these are some of the ways to improve your cholesterol numbers, and the list is not exhaustive. There are more lifestyle modifications that can help. Remember, you absolutely want to consult with your physician, because depending on what your numbers are, your physician may want you to have a medication like a statin, which can help to reduce your cholesterol and help to prevent cardiovascular disease. Also, there are some cases when even when you're doing all the lifestyle modifications, you may be someone who has a genetic predisposition to high cholesterol. You may have FH, or familial hypercholesterolemia. Consult with your physician and ask about your family history. When dealing with cholesterol, you want to be proactive. Consult with your primary physician and find out when you should first get your cholesterol numbers checked. even if the cholesterol is not very high, you want to make sure that you implement some of these lifestyle modifications so that you prevent having high cholesterol. And you can help to prevent heart disease, prevent strokes, prevent having poor circulation, which could lead to amputations.